Here in the studio, a champion for mental health care, someone who has been behind reform for quite some time. We have Senator Bill Cassidy. Thank you for stopping by as you prepare to host a mental health summit today.
Yeah, we're going to have a mental health summit today from Pennington. If people wish to come, you can still register. Registration starting about 8:30, from 9 to 2:30. And we have people from Washington coming in from the NIH, Department of Justice, and SAMHSA. We have folks from San Antonio and Arizona where they've done mental health programs that have saved the state money, saved the community money, but also improved outcomes. And it'll be headed off by a fellow named Pete Early. Pete wrote the book Crazy. That was the community book for Baton Rouge about 3 or 4 years ago about his son's mental illness and his interaction with the criminal justice system. It's going to be a great program.
You know, we talk about mental health all the time down here, and we see issues across the country that really spur the conversation on. We have a chance, the voters in East Baton Rouge have a chance coming up on Tuesday to make a difference. Now, the Bridge Center is what we're talking about there. That has failed at the polls before. If you were to encourage somebody to vote one way or another, how would you encourage them to vote come Tuesday for this mental health facility?
You're going to pay for mental health one way or the other.
Well, exactly right.
Sid Gotro says that he is the #1 treater of mental illness in our community. And every sheriff will tell you that. So if there's a way to get somebody out of the prison into the work environment, working, paying taxes instead of consuming, then that's where you want to be. San Antonio, there's a woman who heads that program, actually from Baton Rouge area. But in that program, again, if somebody is picked up, the police officers have been trained, this isn't a crime, this is a guy who's mentally ill. They'll bring him have an intervention, get appropriate treatment, but not go to jail. That saves a lot of money, saving the jail space for people who should be there, the rapists, the criminals, etc.
Now, you have a lot of people who are going to be on the same page as you today at this mental health summit. Who are you hoping to reach who may not be or who may not understand?
We have breakout sessions in the afternoon, and we so far have about 320 people registered from across the state. And the biggest breakout session by far is how do you reintegrate the mentally ill back into the community? Now, everybody, my family included, has someone who is close to them who has mental illness. You want them to have hope. You want their family to be whole. If we can reintegrate, that is that hope and wholeness. Of course, I'm a doc, and I've seen this play out many times, but I've also seen it play out among my family members. So this is a way that we can hopefully restore to wholeness. That's going to be the biggest breakout session.
We always talk about conversations being a good thing. Whatever the topic is, at some point you hope these conversations lead to something. And at this point in our national conversation about mental health, you would hope that we have reached that tipping point with everything going on coast to coast. Do you think we're there, or are the polls going to show something different?
Well, I can't comment on
the scope of the entire country, yes, but it's just, boy, I tell you.
There is an increasing awareness of this issue.
Yeah. And
every time you have one of these mass shootings, almost every time, it is someone who has been recognized as having mental illness, but whose needs were not addressed. Congress has done a lot. After the school shooting in Parkland, Florida, we created dollars for school systems to put together systems where someone who's troubled, who's asked to leave school, instead of just being tossed out there, is immediately brought to social services and law enforcement. That way we can coordinate. But if there's no local leadership, it doesn't work. So we have created a lot of resources for locals. Now it's just a question of local leadership. And I think Louisiana's there. I think Louisiana is there.
We'll see today at that mental health summit happening. Thanks to Senator Bill Cassidy. Thank you so much for being with us today.
Good to see you.